Hey there! Peedy here, and as always, it's great to see you again. Well, we have now reached the last of the material. I know. It's so sad. Enough doubting. Let's take a look at some of the more common lesions that can be found in the oral cavity. We'll also take a brief look at oral cancer. So, I'll see you on the next page and we'll start this last section. The first lesion that we will look at is Herpes simplex virus. I will abbreviate Herpes simplex virus as HSV. HSV outbreaks are very common. Lots of people have HSV. HSV is mainly transmitted by direct physical contact with an active lesion. After this initial exposure to the virus, recurrent outbreaks are possible. Why some people have outbreaks and others don't? Maybe due to the person's immune system. There are some precipitating or starting factors that can cause an outbreak to occur. Some of the many things that can do this include stress, sunlight, illness, and immunosuppression. Let's talk about some of the clinical findings that are associated with HSV. One of the first findings that may occur is something called a prodromal symptom. A prodromal symptom is an early indicator that tells the person that something's going to occur. They're almost like an aura. Examples of prodromal symptoms include burning, tingling, or itching at the site where the outbreak is going to occur. Once the outbreak occurs, multiple vesicles or blisters pop up on the tissue where the outbreak is found. The vesicles will pop and ulcers are left. HSV lesions commonly present around the lips, but in some cases intraoral lesions can be noted. So, let's take a look at some clinical images of the lesions associated with HSV. Extraoral lesions are the most common. 90% of HSV lesions occur extraorally. Intraoral lesions can also be found in 10% of the HSV cases. The most common locations for intraoral lesions to be found are on the attached gingiva and hard palate. A reactive lesion is a lesion that is caused by trauma. There are a lot of things that can cause a reactive lesion. Examples of things that can cause a reactive lesion include the lesion being self-induced, iatrogenic, chemicals and burns. Do you know what iatrogenic means? Many of the reactive lesions present as an ulcer. So, let's take a look at a clinical image of a reactive lesion. This example of a reactive lesion was created during a fight when the fingernail of one girl ripped the tissue of another girl. After seeing this, I learned that you should make sure to keep your mouth closed during fights. Aphthous ulcers or canker sores are probably one of the most common lesions that you will find in the mouth. We're not sure why people get them, but stress seems to be a big factor. Aphthous ulcers can be quite painful. Aphthous ulcers present in the mouth as an ulcer, and they are found on tissues that are movable. Aphthous ulcers are not contagious. So, let's take a look at some clinical images of aphthous ulcers. Aphthous ulcers present as a single, painful ulcer. These ulcers are found entirely on movable tissues. We use the term Leukoplakia to identify a lesion that's white in color. We then try to figure out what the lesion actually is and give it a name or diagnosis. So, let's take a look at a clinical image of a leukoplakic lesion. Here we see a nice white lesion. Yep, it's a leukoplakic lesion. We would want to ask the patient additional questions to help determine why it is there, as well as what it is or could be. Leukoedema is a known leukoplakia. Leukoedema represents a normal change in the tissue surface of the buccal mucosa. It's more commonly found in African American adults and becomes more noticeable as a person ages. Leukoedema presents as a bilateral white lesion that has a milky-like appearance. It is found on the buccal mucosa. This is an easy lesion to diagnose. If you stretch the patient's cheek, the lesion disappears. Let the cheek go back to normal, and the lesion reappears. So, let's take a look at a clinical image of leukoedema. Leukoedema is found on the cheek of many African Americans. Leukoedema is bilateral and will disappear when you stretch the patient's cheek. Hyperkeratosis is another leukoplakic or white lesion. Hyperkeratosis is caused by chronic rubbing. A loose-fitting denture or chronic cheek biting are examples of things that can create hyperkeratosis. As a way of protecting itself, the tissue will thicken. When the tissue thickens, it becomes whitish in color with a rough texture. In addition, this thickened tissue can't be rubbed off when it is wiped. So, let's take a look at a clinical image of hyperkeratosis. Hyperkeratosis can be found in any area that can be traumatized by chronic rubbing. Hyperkeratosis presents as a rough, white lesion that won't rub off when wiped. So, let's take a look at something called hairy tongue. Hairy tongue can be a leukoplakic lesion, but can appear in different colors as well. As you know, you are supposed to brush your tongue. In cases of patients that don't brush their tongue, the filiform papillae can grow. Yep. Go figure. So, let's take a look at a clinical image of hairy tongue. Hairy tongue is caused by the elongation of the filiform papillae, and this relates to the patient not brushing their tongue. This picture shows you an example of when a patient does not take the time to brush their tongue and rinses with peroxide. The tongue becomes leukoplakic in color. I want to show you another case of hairy tongue. In this case, the patient is a smoker and the tongue has a darker color on it. Snuff keratosis is an asymptomatic white lesion that's created when a person places smokeless tobacco onto the oral tissues. The chemicals within the tobacco irritate the tissue and create a tissue change. The common appearance for snuff keratosis is a leukoplakic, wrinkled lesion. The most common area to see this lesion is the buccal vestibule of the mandibular posteriors. So, let's take a look at some clinical images of snuff keratosis. Placing some sort of smokeless tobacco on the oral tissues is not good. Here is what it can do to the tissues. The tissues will attempt to protect itself by thickening up. Here is another fine example. The tissue will become wrinkled as time goes on. Candidiasis or thrush is another leukoplakic lesion. Candidiasis is caused by a fungus named Candida albicans. Candida albicans is present in everyone, but it's not typically seen under normal conditions. Some conditions are associated with outbreaks of Candida albicans. Some examples include diabetes, when a person is taking an antibiotic, and immunosuppression. Outbreaks of thrush can also be seen in babies and in the elderly. Thrush presents as a white, soft plaque-like lesion. One of the ways to help tell if this is the condition is to wipe it off. After wiping the lesion off, it will leave a raw, red surface. So, let's take a look at a clinical image of candidiasis. Candidiasis presents as a leukoplakic lesion that wipes off when rubbed. Candidiasis is not something that we expect to see in healthy patients, but presents when the patient has some sort of issue going on. We use the term Erythroplakia to identify a lesion that's red in color. If an erythroplakic or red lesion is found in the oral cavity, we need to come up with a diagnosis or name for the lesion that we're looking at. Unexplained red lesions are found less frequently in the oral cavity. So, let's take a look at a clinical image of an erythroplakic lesion. Unexplained erythroplakic lesions are less commonly found in the oral cavity. Since they are less frequently seen, we want to pay special attention to them. Geographic time is a strange condition that occurs on the dorsal surface of the tongue. We aren't sure as to why it occurs, but as always, stress could come into play. Geographic tongue reflects the loss of filiform pupillae, and it creates a mat-like appearance on the tongue. So, let's take a look at a clinical image of geographic tongue. Geographic tongue can be a really cool lesion at times. It can present in lots of different patterns, but it involves the loss of the filiform papule on the dorsal surface of the tongue. A Nevi, or mole, presents as a pigmented lesion on the skin. At times, we can even find them intraorally. If a mole is found intraorally, it will typically be found on the hard palate. So, let's take a look at a clinical image of a Nevi. Nevi present as pigmented lesions on a given tissue. Intraoral nevi are not a common finding. So, if they are found, make sure to do follow-up evaluation on the patient. You know what a tattoo is. But did you know that there is something called an amalgam tattoo? Amalgam tattoos are created when amalgam is placed into the oral tissues, or when a large amalgam restoration chronically rubs the tissue surface. Amalgam tattoos present as a flat, bluish-gray pigmentation. That's typically close to an amalgam restoration or where a tooth used to be. So, let's take a look at a clinical image of an amalgam tattoo. Amalgam tats are created when amalgam gets into the adjacent tissue. The amalgam will create a bluish-gray pigmentation on the involved tissue. Alrighty now. We're now going to take a brief look at squamous cell carcinoma. Yep. Oral cancer. Squamous cell carcinoma or oral cancer is a malignant cancer. Many of the patients that are diagnosed with oral cancer will die. Although oral cancer is associated with an unknown etiology, there are some risk factors that are known to increase the risk for developing oral cancer. Some of the risk factors that are associated with squamous cell carcinoma include tobacco and alcohol usage, increased age, and sun exposure. It is common for oral cancers to be asymptomatic during early growth stages. There are some early warning signs that may indicate that there is an issue going on. Some of the early warning signs include sores that fail to heal, areas that bleed without cause, numbness, burning, or altered sensation, difficulty in chewing, swallowing, or moving the tongue or jaw, feeling a fullness or discomfort in the throat. These signs don't tell you that the patient has a cancerous lesion, but they warrant a closer look at the oral tissues. Here are some other findings that are associated with oral cancer. Oral cancer is more commonly found in males. Oral cancer is more commonly found in African Americans. Oral cancer does not have a typical appearance. They can present in any color and any type of surface pattern. Oral cancer is more commonly found on the posterior lateral border of the tongue, floor of the mouth, and oral pharynx. So, let's take a look at a few clinical images of squamous cell carcinoma. This oral cancer is found on the lower lip. Many of the oral cancers of the lower lip are related to excessive sun exposure. Here is an oral cancer that is found on the floor of the mouth. As you can see, this one looked different than the one that you saw on the lower lip. And here is another one. This nasty one is found on the ventral surface of the tongue. Well, we have officially reached the end of this course. Thanks for doing such a great job this semester. I hope that you enjoyed this course. Until later, ciao.